So in this video, we'll be discussing about the different type of abnormalities during the process of gastrulation. So what happens when a mother consumes alcohol when she is pregnant, right? When a mother consumes alcohol when she is pregnant. So it affects the germ disk or the entire embryo. So damage of the embryo during its early development is called as teratogenesis. And those substance which causes teratogenesis is called as teratogens. So high level of alcohol intake during the development of trilaminar germ disk damages the developing embryonic tissue, and that is called as teratogenesis. So when trilaminar germ disk is formed, the cells are pre-programmed so that from which cell what tissue must come out, it is already a pre-programmed program. So it is a pre-programmed program that from which cell what tissue must come out, it is already decided. So when the trilaminar germ disk develop, particularly during the time of development of a trilaminar germ disk, if a mother consumes alcohol, it leads to the destruction of the trilaminar germ disk, or it damages the trilaminar germ disk. So what happens? It leads the malformation, physiological malformation, and that is called as teratogenesis. So which period is considered as the most dangerous time of development of embryo? It is from third week of embryonic development to 8th week of embryonic development. This is considered as the most dangerous period of development. Because during this period most of the organs develop. So when a mother consumes alcohol or some other drugs, so it leads to the destruction or damage of the trilaminar germ disk, which is formed in between the weeks of 3rd and 8th. So after 8th week, what happens? It is just the maturity of the organs. Further development is the maturity of the organ system. So what happens when a mother consumes alcohol? Again the same. So alcohol, all of you know that alcohol is highly lipid soluble. And hence it can pass through the placenta very easily. It can easily pass through the placenta. So if mother takes alcohol, it affects the cephalic portion of the trilaminar germ disk. So the net result is improper formation of forehead, nose, and other midline structures. So because it is the result that is developed due to the damage to the precaudal plate. So in the cephalic portion, it is mainly the precaudal plate that gets affected. So it leads to improper formation of forehead, nose, and other midline structure. So let us see what are all the consequences that has been resulted due to the damage to the cephalic portion of the trilaminar germ disc, that is mainly the precaudal plate. It results in the approximation of eye. So, approximation of eyes. And the approximation of eyes is termed as hypotelorism. Telorism. Especially it results in the underdevelopment of forebrain. Then the lateral ventricles, they also become approximated. They come nearer to each other. They may even fuse. So all these conditions related to the abnormality of cephalic region due to alcohol intake is given a name, and the name is called holoprosencephaly. So these are all the abnormalities related with the cephalic region of a developing embryo. Then coming to caudal dysgenesis. It is also called as sirenomelia. Of course, it is also given another name. It is called as a mermaid syndrome. So, what happens really in this condition? This leads to underdevelopment of caudal mesoderm. So again, underdevelopment of the caudal mesoderm is due to the diabetes mellitus of mother. So now let us see what are all the consequences that is resulted due to caudal dysgenesis or sirenomelia or mermaid syndrome. So if there is insufficient mesoderm in the caudal part, there will be underdevelopment of lower limbs, or they may also fuse together. So then abnormal vertebral development. Then of course renal agenesis. Kidneys may not be formed. Then genital abnormalities. And imperforate anus. Already we saw that in the previous lecture itself that the cloacal membrane, in the future it will be developing into the anus. So what happens in the caudal dysgenesis? This cloacal membrane do not rupture, so there will be no space, that is no natural opening, right, for the anus. If the cloacal membrane do not rupture, then there will be no anus, proper anus. It will be as an imperforate anus, right? So these are all the consequences that is resulted due to caudal dysgenesis. Okay. So then the abnormalities that is resulted due to the improper location of different organs. First, let us look into heart. So heart, it is usually in the mediastinum. If it is present on the right side, more on right side, then it is called as dextrocardia. Then if all organs are wrongly located, then it is called as situs inversus. That is site of the viscera is inverted, right? Situs inversus. So looking upon the natural cause for situs inversus. So if during gastrulation the right and the left side do not orient themselves properly, then it will result in situs inversus. So another interesting thing with people who are affected with the situs inversus, that is people who are affected by situs inversus, 20% of the people are only with additional problems. That is 20% of the patients are only with additional problems. Remaining 80%, no problem. The only problem is that the organs are not in their proper organized position, that's all. Apart from that, they do not have any additional problems. What additional problems do these 20% of the patients get? So first problem I am discussing it is cilia do not develop properly. Because they will be having abnormal dynein proteins. So cilia will not be developing properly, right? Then it results in problems, various problems it results, but particularly I am mentioning about the chronic sinusitis, right? I hope all of you know about the maxillary sinus. So consider this as the nasal cavity, and this is the maxillary sinus. So in the normal persons, maxillary sinus has cilia in it. So what happens? The maxillary sinus has cilia in it. It will push the mucus formed in it to the nose, right? If the cilia are not functioning properly, or if the cilia is absent, then it will lead to collection of mucus in the maxillary sinus, and thus it remains as a beautiful culture medium for the bacteria. So many bacteria will be rapidly proliferating in that sinus, and this will lead to chronic sinusitis. So if cilia are not present inside the maxillary sinus, it leads to sinusitis, right? So the next is, so normally if any bacteria or microorganisms or any foreign bodies enter the lungs, it is mixed with the mucus and thrown out into the esophagus or stomach, right? So it will be coming out through the feces the next day, right? So if the mucus is thrown out, it is called as sputum. About 1 cup of sputum is produced daily. So if the mucus is not thrown out, because cilia is not properly developed in the 20% of the patients with situs inversus, right? So if cilia is not well developed, then mucus is not thrown out, so it causes the dilatation of bronchi with full of infections, that is the bacterial infection, because it serves as a beautiful culture medium for the development proliferation of the bacteria. So it results in the dilatation of the bronchi with full of infection, and this is called as bronchiectasis. And of course again the dynein proteins is not properly developed, okay? So due to that, male faces infertility due to the immobility of the sperm. So a beautiful name is given to the triad of disorders discussed above, and the name of the disorder is called as Cartagena Syndrome. And those disorders which come under the syndrome triad of disorders I said now. So the first one is situs inversus, then it is chronic sinusitis, and the other is bronchiectasis. So it is a result of autosomal recessive genetic ciliary disorder. So all these three are, of course, situs inversus, it also comprises many other complications which is resulted due to the improper development of cilia. So all these are related together under a common name which is called ciliary disorder. This results due to the improper dynein formation, dynein proteins, right? Improper formation, that is the malformation, or of course the absence of dynein proteins, like that, right? So these are all the general complications or disorders that occurs during the development of an embryo. Thank you.